History of Nursing, 1980 to the 21st century. This presentation will review the changes the AIDS epidemic brought to the medical field, transitions to electronic systems, educational shifts to the nursing profession, and legislation changes leading to the increased need for professional nurses. 1980s. In 1981, the first case of HIV/AIDS is seen in the United States. By the end of 1981, there were 337 reported cases, 16 of which were children under the age of 13. This was the start of a global health crisis causing widespread fear, panic, stigmatization, and discrimination against those affected. It is argued that this event changed nursing care from fear-based isolation to compassionate, evidence-based nursing. Helen Miramontes was elected as president of the California Nurses Association in 1985. She was an HIV/AIDS activist and a key committee member for the AIDS Education Training Center and nursing coordinator for the Pacific AIDS Education and Training Center. Helen fought during the height of the AIDS epidemic to bring more nurses into the battle against HIV and AIDS and to provide healthcare professionals the knowledge and skill set that's needed to serve those affected with the disease in underserved and at-risk populations. She later became the deputy director of the International Center for HIV and AIDS Research and Clinical Training in Nursing. During the 1980s, there was a sizable shift for increased nursing education. Many programs began to move from hospital-based nursing diploma training to university-based education and BSN programs due to the increased need for higher professional status, advances in research, the increased complexity of care training, and the changes in technology used in the medical field. It was during this time that more nursing research efforts were spent on patient care from a holistic approach. Obtaining a bachelor's degree in nursing is an expectation in today's nursing climate, with employers and state agencies pushing nurses and offering incentives to continue their education. In 1985, the CDC introduced universal precautions out of response to the HIV epidemic. This established standardized guides to preventing infection from bloodborne pathogens. Prior to this, it was not uncommon for nursing to provide patient care without the use of barrier protections, and hand washing was inconsistent, causing an increase in exposure and transmission. Today, all employment settings are encouraged with OSHA guidelines to have full PPE kits and blood spill kits on site in case of an emergency. In 1985, the ANA formed the Council of Nursing Informatics. With the increased technological shift in the 1980s, there was an increased need for specialized nurses to help use new technology to advance patient care. The purpose of this council was to improve patient outcomes and aid nurse workflows through technological advancement and continued nursing education. In 1986, the National Center for Nursing Research was created. Originally vetoed by President Reagan in 1985, the NCNR elevated nursing sciences with the objective to support and publicize patient care research within the federal research environment. The NCNR became the National Institute of Nursing Research in 1993 and is still operating today. The 1990s marked a revolution in nursing through the professionalization of care and the emergence of evidence-based practice and landmark federal legislation that forever changed how nurses document, communicate, and deliver care. Evidence-based practice was among the most important shifts of the decade. Nursing had long relied on tradition and intuition, but the 1990s pushed the profession towards a research-oriented model. The IOWA model of evidence-based practice was developed in 1994 by Dr. Marita Titler and colleagues at the University of Iowa, providing nurses with a systematic process for applying research findings to bedside care. It became one of the most widely adopted evidence-based practice frameworks globally. The ANA formally recognized nursing informatics as a specialty in 1992, followed by the scope and standards of practice in 1994. Early electronic medical records began appearing in hospitals, requiring nurses to develop digital competencies alongside their clinical skills, laying the foundation for today's integrated health systems. HIPAA was signed into law on August 21st, 1996. establishing national standards for the protection of patient health information. It transformed how nurses record and safeguard data, making legal literacy around confidentiality and consent a fundamental professional responsibility. At the organizational level, the ANA's Social Policy Statement of 1995 defined nursing's relationship with society and strengthened autonomous practice. The NLN led curriculum reform, emphasizing critical thinking and community-based education. The AACN's Essentials of Baccalaureate Education of 1998 set the BSN academic standard that continues to be referenced today. This slide honors 6 individuals whose contributions during the 1990s made a lasting impact on nursing practice, education, and professional identity. Dr. Loretta Ford co-developed the nurse practitioner role in 1965, and her continued advocacy into the 1990s expanded the NP scope of practice legislation across all 50 states. By the end of the decade, over 60,000 nurse practitioners were practicing in the United States. Dr. Virginia Henderson's 14 Basic Human Needs Theory was the backbone of nursing education worldwide throughout the 1990s, translated into more than 25 languages. She passed away on March 19, 1996, at the age of 98, leaving a global legacy that continues to shape nursing curricula to this day. Dr. Madeline Leninger founded transcultural nursing as a formal specialty. In her 1991 publication, Culture, Care, Diversity, and Universality, she argued that culturally congruent care is not optional but a practical necessity, giving nursing an effective framework for serving an increasingly diverse patient population. Dr. Marita Titler, Director of Nursing Research at the University of Iowa, developed the IOWA model of evidence-based practice in 1994. It became one of the most cited frameworks in nursing history, creating a direct link between academic research and frontline clinical decision-making. Dr. Joyce Fitzpatrick, Dean at Case Western Reserve University, founded the Applied Nursing Research Journal, providing a peer-reviewed outlet that accelerated the spread of nursing science throughout the decade and helped establish nursing as a serious academic discipline. Dr. Luther Chrisman, the first male dean of nursing school, founded the American Assembly for Men in Nursing. Throughout the 1990s, he firmly opposed gender-based barriers in the profession, advocating for equal hiring and admissions and broadening the public's understanding of who nurses are and can be. Moving into the early 2000s, the electronic medical record was a pivotal move to advancement in technology. It gave better access to patient records, information, and charting systems. Cleveland Clinic was one of the first to adopt the new charting, moving from smaller market to more mainstream and easier accessibility. Starting in outpatient settings in 2000 and moving into inpatient and real-time nurse charting became standard in 2005. The average age of nursing faculty reached 49 to 52 years by the early 2000s, leading to enrollment limitations in nursing schools and a bottleneck in training new staff. The decrease in faculty meant minimal nursing graduates, creating a supply shortage in the workforce, leading to unsafe ratios and nursing burnout. This concern continues to this day. Magnet was first initiated in 2003. Magnet accreditation is awarded to hospitals for overall nurse satisfaction, high-quality care, and increased patient satisfaction. Magnet has 5 core components: transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovations, and improvements, and empirical outcomes. Hospitals must meet all criteria in all categories to obtain or maintain their Magnet status. The American Association of Colleges of Nursing recommends that all advanced practice nurses earn their doctorate in nursing. On October 25, 2004, the member schools affiliated with the AACN voted to endorse the position statement on the practice doctorate in nursing. As programs developed, priority was placed on research-focused education that would lay the groundwork for knowledge development in the field. Tremendous strides have been made in the development of nursing science. DNP and the Future of Nursing Initiative prioritizes advancement, professional satisfaction, leadership roles, professional development, and includes comparisons of outcomes amongst DNP-prepared nurses versus those holding other nursing or healthcare-related doctoral degrees and examinations of career trajectories for DNP-prepared nurses compared to non-doctorally prepared nurses. In 2010, the Institute of Medicine reports The Future of Nursing, which recommended that nurses practice to the full extent of their education and called for 80% of the workforce to hold a BSN by 2020. The Affordable Care Act was passed in 2010. By implementing the Affordable Care Act, it increased nation's access to health care, thus increasing the needs for nursing professionals in the workforce. Advancements. A. Automated med machines were introduced in the 1980s. They ensured better tracking of medications, more access to medications on floor units, and decreased the number of medication errors. D. Degree programs. 1982 saw that many states were approving education for BSN, MSN, and LPN to RN programs, and DNP programs came to fruition in the 2000s. V. Virginia Henderson. Dr. Virginia Henderson was a nurse educator. She went on to finish her schooling and taught at Teachers College. She was also well known as a writer. She wrote the text Principles in Practice of Nursing, which argued that healthcare needed reformation regarding nurse-to-patient education and independent care. A. AIDS and HIV. The epidemic of the 1980s caused widespread panic due to lack of knowledge of the disease. The first outpatient clinic, Ward 86, was opened and dedicated to compassionate care of people with AIDS. N. New organizations. The JCAHO, though originally founded in 1951, transitioned from structural inspections to performance-based accreditation in the 1980s. They changed their name in 1987, which encompassed more of their scope of focus. C. Congress. In 1992, Eddie Bernice Johnson became the first nurse elected to Congress, giving nurses everywhere a voice for change. E. E-records became more mainstream in the 2000s, allowing better access to charts and more accurate documentation for both inpatient and outpatient. M. Madeline Leininger. Dr. Madeline Leininger developed concepts of how culture-based care affects patients' experiences and outcomes. E. Evidence-based practice. Evidence-based practice is based on standardizing research and guidelines for evaluating the quality and relevancy of research evidence in healthcare. N. Necessity for legislation. The HIPAA Act of 1996 protects patient privacy, allowing repercussions for breaking patient confidentiality. The EMTALA Act of 1985 required hospitals to care for and stabilize patients entering the emergency department regardless of their ability to pay. T. Transformation of care. Transformation of care has come a long way from task-oriented to a more professionalized, compassionate, and evidence-based model. S. Staffing shortages. This has been an ongoing problem from early nursing up to present day. There aren't enough new nurses coming into the workforce as there are leaving. Fluctuations have occurred over the years, but it continues to be a concern for nurses with regards to nurse burnout and patient safety. In 1987, Princess Diana garnered attention for shaking hands with an AIDS patient without wearing gloves. This action had a notable impact on reducing the stigma associated with AIDS transmission. How do you think this moment played a role in the way that we provide nursing care today?